adolescent psychiatric disorders. You learn about childhood and adolescent psychiatric disorders. We'll discuss the potential causes, symptoms, and treatments of 4 major disorders. These disorders are attention deficit hyperactivity disorder ADHD, autistic disorder, conduct disorder, mental retardation. Learning more about these disorders can help both those who suffer from them and those who don't find solutions and understand each other well. Please remember that medication can only be prescribed by GPs, psychiatrists, or nurse prescribers. Topics to be covered: attention deficit hyperactivity disorder, ADHD, autistic disorder, conduct disorder, mental retardation. Attention deficit hyperactivity disorder ADHD. Attention deficit hyperactivity disorder ADHD refers to the disorder which results in interferences with day-to-day functioning or development due to inattentiveness, hyperactivity, and impulsiveness. ADHD is commonly associated with children around school age, though it can affect people of any age. Children can be as young as 4. Some children grow out of the symptoms, others don't. The phrase ADHD covers behavior which is considered developmentally inappropriate. It usually results in the individual being unable to focus when given a task. Boys are more frequently diagnosed than girls. Causes. Like many mental health problems, the causes of ADHD are not always clear. It is believed that the hyperactivity deficits often stem from the neurotransmitters norepinephrine and dopamine. The impulsivity is a result of serotonin. ADHD is often associated with birth complications, low weight at birth, mother using drugs while pregnant, child abuse, high stress, lead poisoning. There also seem to be genetic links. Close relatives to the child are likely to have been diagnosed with ADHD. Symptoms. ADHD symptoms can also vary between people. Symptoms include impulsiveness. This can involve interrupting others, difficulty expressing feelings, difficulty taking turns, misbehavior. Hyperactivity. Often the most noticeable symptom. Children with ADHD often fidget, work on multiple tasks at once, move and speak constantly. Inattentiveness. This often involves avoiding complex tasks, making multiple mistakes, inability to finish tasks, getting distracted easily, unwillingness to try new things. Treatments. Treating ADHD is challenging. There are no cures presently. Children with ADHD need support from their teachers, parents, and the educational system as a whole. Understanding the symptoms is often key to finding coping mechanisms, and these tend to vary from person to person. Some medications can be given to adult sufferers of ADHD. Other treatments may include cognitive behavioral therapy (CBT). Therapies aim to help patients develop better coping strategies and control their impulsiveness. They may help patients better express their emotions. Autistic disorder. This usually manifests itself as difficulty with interactions. Children with autistic disorder may struggle to communicate with others and respond appropriately. They're less likely to engage with and understand the world around them. This can lead to feelings of isolation. Autism occurs more commonly in boys than girls, and it's a condition which is usually present from birth. It will continue throughout the individual's life. Causes. It's unclear what causes autism. Scientists are researching extensively, but have only come to vague conclusions at this stage. There are some theories surrounding the fact that brain structure and function seems to be different. There have also been studies done regarding impaired neural development. A few other potential causes include pregnancy complications, predisposition in the genes, environmental factors. There are some claims that certain viruses and chemicals can cause autism. Symptoms. Autism has a multitude of symptoms, unsurprisingly changing with the child's development. An infant with autism might avoid eye contact. They may lack normal developmental signs such as cooing, grasping, waving, pointing, etc. An older child or adolescent or adult with autism may show any of the following: discomfort with eye contact, inability to express emotions, strong or apparently unreasonable emotions, inability to form friendships, fear of change, preoccupation with material possessions. Treatments. As with ADHD, no cures exist for autism. Medication may help with mood swings and any associated anxiety. Children with autism can also be helped by family counseling. This is geared at helping the family deal effectively with the child's behavior. Special education. For children who aren't able to go into mainstream education, special education programs may be appropriate. Mainstream education with extra assistance. Where possible, autistic children should attend regular schools and can be provided with someone to help them deal with their individual challenges. This will only work if an autistic child is able to cope in a classroom setting. Conduct disorder. Conduct disorder refers to antisocial and socially unacceptable behavior. It often involves harming others in some way, and so can be very difficult to deal with effectively. If not diagnosed, it can lead to devastating consequences for the individual. They may get removed from the school system, or find themselves in trouble with the authorities as a result of the disorder. As with other mental problems, conduct disorder is not the fault of the individual. They will need support from others to deal with the problem. Causes. Conduct disorder has no obvious cause. It occurs before the age of 18 and can appear as early as the age of 10, early onset conduct disorder. Again, it's more common among males than females. Detachment from family may be the biggest factor in conduct disorder. It also has some ties with ADHD. Around 50% of children suffering from conduct disorder also have ADHD. Children with conduct disorder often become adults with antisocial personalities. Symptoms. The symptoms of conduct disorder can vary from child to child and may change as a child matures. There are a few common symptoms which can help with diagnosis. These include stealing from others, physical fighting, verbal abuse and swearing, absconding from school, cruelty to animals, bullying, sexual abuse, drug or alcohol abuse, destructive behavior, often a property of others. Treatments. Again, there are no simple cures or treatments. It can be approached by addressing the individual symptoms a patient is exhibiting, for example, encouraging them to remain in school if their attendance is dropping. It can sometimes be managed through psychotherapy. This may help an individual improve their problem-solving skills and bond with others. It may also help them modify their behavior. Sometimes systems of reward and consequence are effective. Mental retardation. Children who suffer from mental retardation have an IQ below 70. This means that they will not develop as quickly as other children of the same age, which can have serious implications in both the short and long term. There are various exams which can be done to diagnose children with mental retardation. Several different grades of mental retardation exist. Profound, IQ less than 20. Severe, IQ 20 to 34. Moderate, IQ 35 to 49. Mild, IQ 50 to 70. Causes. Over half of children diagnosed with mental retardation had a predisposition to mental health issues. 40% do not. These predispositions could include pregnancy or birth complications, metabolic disorder, early childhood trauma, childhood disease, genetic disposition. Children with mental retardation are likely to suffer from other health problems too. They will need help from medical professionals and their educators to mitigate the issues they face. Symptoms. Mental retardation is often detected through the child's inability to meet milestones which all their peers can meet. It can also show itself through behavioral issues. The symptoms vary, but may include inability to look after themselves, immaturity, inability to deal with frustration, language problems, inability to meet developmental milestones, poor psychomotor skills, poor social skills, issues with following instructions. Treatments. Mental retardation is usually best dealt with through education. There are no medical treatments available. To help someone who has mental retardation, you'll need to take a varied approach and pay attention to their areas of weakness. This approach might involve assistance with speech. Helping a child communicate ensures they can express when they need help. Education. Supporting a child's education maximizes their potential. Behavioral management. Finding ways to manage difficult behavioral patterns. Family therapy. Supporting the family reduces stress and improves the child's environment.